Your meeting is live. You may begin.
Thank you, Amber. This is, for the record, James Hum, Executive Director, Cannabis Compliance Board. And I'd like to call to order the meeting of the Cannabis Advisory Commission of the State of Nevada. If you will, please, Sarah, can you call the roll?
Member Bertolo?
I'm here.
Member Britton?
Present.
Member Carefield? Attorney General Ford?
I'm here.
Director Hughes?
If I may, my name is Yvonne Navarez-Goodson. I'm here on behalf of Director Hughes today with the Department of Taxation.
Member Joy? Dr. Spiritos?
Here.
Member Terry? Director Togliatti? Dr. Tung?
Here.
Chair Hum?
Here. Do we have a quorum?
Yes, we have.
We have a quorum. Thank you, Sarah. First item on the agenda, public comment. We ask that to limit any public comment to 3 minutes. First, I'll go to the physical room here in Las Vegas. Is there anyone here for public comment?
Excuse me, may I read the call-in instructions to join first?
My apologies, Amber. Yes, absolutely. Please do.
To provide public comment via telephone, call 669-444-9171. Enter webinar ID 815-5636-6464, followed by passcode 260437.
Thank you, Amber. While we give people a minute to dial in, take public comment here in Las Vegas. Anyone for public comment? There is not. It's just us. So, Amber, is there anyone on the phone or online that would like to give public comment?
If you wish to provide public comment, dial *9 to raise your hand. I see no one on the line for public comment at this time.
Thank you, Amber. Now moving on to agenda item number 2, introduction of chair and member updates. I will give a brief intro as I know everyone's schedules are tight on this Friday morning. So just want to say thank you to all the members. I know that everyone's schedules are exceptionally busy, but this is extremely important work that we're doing here via the Advisory Commission. And so I just want to thank everyone for their time and their efforts to participate in these commission meetings. Also want to give a special thanks to Ashley Balducci and the subcommittee on rescheduling, descheduling, who without her efforts and those of the members of the subcommittee, we actually would not be here today. So thank you to Ashley for that. Super excited about the way that the report turned out. So thanks again to Ashley, who unfortunately couldn't be here today. One housekeeping item. Member Lori Rogich resigned from the commission, a couple weeks ago. So we'll be looking for a replacement for hers in the upcoming week. So again, thank you so much to Ms. Rogich for her service on the commission. It was fantastic, and we're sorry to lose her, but we will find someone great for the commission as well. So with that, I will move on to agenda item number 3. I must abstain from this vote as I was not a member of the commission at that time, but we will go to consideration for approval of the August 15th, 2023 Cannabis Advisory Commission meeting minutes. So this is for possible action. Any discussion on the minutes?
No discussion, but if you're ready for a motion, I move approval.
I'm ready for a motion, Attorney General.
I move approval of the minutes.
Do I have a second?
Aye.
Will second the motion.
Mr. Britton, second. I'll open it up to a vote. All those in favor say aye.
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 Those opposed? Ayes have it. Motion passes. Thank you. All right, moving on. Agenda item number 4, discussion of draft report and recommendations of the subcommittee on rescheduling, descheduling of cannabis for discussion only. So just some quick overview. This report is the result of SB 277, which mandates the CAC to conduct a study examining the potential effects on the Nevada cannabis industry if cannabis were to be removed from the list of controlled substances included in Schedule 1, including recommendations on changes to the manner in which cannabis is regulated and taxed in Nevada. Additionally, it is to emphasize that the purpose behind this report is to help lawmakers prepare for if any scheduling changes are made to cannabis, either on the federal or the state level. The subcommittee on descheduling met 7 times, heard from subject matter experts on this topic. The result of what they found, their findings, final report, is what's presented before you today. Just some quick background. This topic is obviously constantly evolving. So that's why we kind of pushed this so close to the March 1 deadline to get it to the legislature, just to see if anything did pop at the end at the federal level. Obviously, this was final submitted about 2 weeks ago. But it is due to the Legislative Council Bureau next Friday, March 1st. So that's why we're hearing it today. This will not only be sent to them, but it will also be shared internally, obviously, to myself and my team. So today we will discuss the report. If anyone has any discussion topics before we vote on it, extremely well researched, and they did just a great job on the report. Ashley couldn't make it. Are the rest of the subcommittee members here? Okay. So we're joined here today by members of the subcommittee. Unfortunately, Chair Balducci could not make it today, but CAC members who also were on the subcommittee I apologize if I pronounced the name wrong, but Dr. Bertolo, Member Britton, and Director Hughes were all part of the process. And we're also joined by another subcommittee member, Mr. Andrew Klein, who is the co-chair of the cannabis practice at Perkins Coie and is based in Denver. He's led public policy for the National Cannabis Industry Association and 14 years as a federal prosecutor, worked with then Senator Biden on the Judiciary Committee and handled crime and drug policy under then VP Biden. So these subcommittee members are available for any questions as well. So now I'd like to open up the floor for discussion or any questions on the report itself.
Hi, Aaron Ford for the record. Thanks so much, Mr. Chairman, and thanks to the committee members for taking time to put together this robust report. I'll note before the motion that many of the recommendations in the report, maybe not many, but several of them certainly have been contemplated and approved already by the legislature. For example, the decriminalization of some of these offenses, as well as even at the pardons board level, where we last year, a couple of years ago, pardoned those who have been convicted of marijuana-related offenses. And so some of the recommendations have already been, in fact, implemented. And I wanted to acknowledge that as we continue moving forward. And with that, again, I will turn the floor back, but I just wanted to say thanks again to the committee for the diligent work on this. And once the chair is ready for a vote, I will be supporting it and can make a motion when you're ready.
Thank you so much, Attorney General, and looking forward to working with you and your team on this as well. Any additional discussion on the report? Dr. Spiritus.
Nick Spiritus for the record. Was there any consideration given to the possible impact, financial impact, on current license holders of potentially big pharma, large corporations entering into the marketplace, which seems to already be struggling, particularly widespread sale of cannabis products through Walgreens, CVS, in which, in my opinion, would be very difficult to compete with.
Any members on the subcommittee that would be open to answering that?
I'd be happy to try to take a crack at answering that. I don't know that we debated that robustly. There are some people who have been concerned about the possibility of big pharma coming in, particularly if DEA agrees with FDA and reschedules to Schedule 3. I'm a member of a large coalition of companies, doctors, scientists, lawyers, and policy experts, and none of us believe that is going to happen. Big pharma normally would spend $1 billion on clinical trials and pre-market review of a drug for a specific population for a specific ailment. And because cannabis is so ubiquitously available throughout the country, 38 state medical markets, 24 recreational or adult use markets, we don't see a scenario by which big pharma comes in any real way. And if someone were to develop a drug, for a specific ailment, nausea or pain, for instance, it would be, available as a pill if they wanted to do a clinical trial and go through that process. It would be available at CVS, but we don't believe that would in any way disrupt the recreational or medicinal marketplace as it exists today. The other products we believe will still be available. One of the people that we had consulting with us, both in our coalition and for this group, Howard Slamberg, who's a partner at Arnold & Porter. He's a former deputy commissioner at the FDA. He was actually in charge of the 2016 review, and he agrees that this is a bit of a red herring and doesn't think that that we should be concerned about big pharma coming in a substantial way.
Thank you, Mr. Klein. Anything additional, Doctor?
None.
Okay. Any additional discussion on the report?
This is Member Britton. I think one of the big takeaways that I had as we were creating this report was kind of it was hard to really nail down with the new, in light of the news from the FDA, and then, kind of speculating what DEA was slated to do. So I think we did put a lot of consideration into the report as far as what that would look like in that hypothetical situation. I think it's the opinion of everyone in the industry that hopefully the DEA follows the FDA's report. So, I think the report kind of contemplated that.
Terrific. Thank you. Any additional discussion? Oh,
We can't, Director Tagliati is trying to speak, but we can't hear you, sir. It's not working. You're not on mute, but it's not working.
do you want to potentially drop off and then jump back on, Director? That might work. While we wait for Director Tagliati to jump back on, does anyone else have any discussion on the report?
Hello, listen, Member Tom. To echo the Dr. Sparrow's question. My understanding, if everything goes forward, FDA, everything approved, because I'm a testing lab or representing testing lab for the state, we only have 8 labs throughout the state. If the border is open, so to speak, and we will compete with the whole country on this testing. So Nevada state might want to establish some kind of guideline. If the testing was done out of the state, what do we do about the products? Just a thought.
Terrific. Thank you, Dr. Tung. Certainly something to take a look at.
Would you like a committee member to comment on that question?
Yeah, that would be great. Thanks, Member Britton.
Oh, sorry, this is Member Klein.
I'm sorry, Member Klein. My apologies, Member Klein.
We have every expectation that DEA is going to do one of three things: either keep marijuana in Schedule 1, move it to Schedule 2, or move it to Schedule 3. We're of course hoping that DEA is going to move it to Schedule 3. There's absolutely zero expectation that DEA is going to deschedule cannabis. The only way that interstate commerce would open up federally would be if we were to deschedule cannabis. It's almost impossible for that to happen through an administrative process because DEA would have to find that there's zero abuse potential for cannabis, and we don't believe that is a thing. There is some abuse potential in cannabis. The only way to deschedule cannabis, we believe, is through a legislative process. And given the political environment right now in Washington, we don't see that happening anytime soon. So we don't think any scenario that's going to come out of this rescheduling process, this administrative process, is not going to impact interstate commerce.
Great. Thank you, Member Klein. My apologies again. Is Director Tagliati back on? Director Tagliati, did you have additional comments?
Hello,
Guys,
can you hear him?
We can. Yes, thank you.
sorry about that.
No problem.
I can barely hear you, but
Oh, there you go, Director. We can see you now too.
okay. I'm sorry. I could barely hear you, but I'm glad you can. Wow, I got volume totally up too. I didn't mean to interrupt. When I get a chance, I'd like to add something.
Please do. You have the floor, Director.
Okay. Just an observation I have when we're discussing the sections regarding the criminal justice reform. I'm not sure on the committee who may or may not have updated information on basically from a law enforcement perspective of some of the things that are going on, but some of the verbiage, I realize they use the term could and possibly and so on and so forth, which kind of lightens it. But for example, a sale of marijuana in Clark County is not a felony. It's a misdemeanor. No one has gone to trial on possession in Clark County that I know of. A number of people that are in prison strictly for possession of marijuana is also would be extremely rare and certainly not coming out of Clark County, for example. I refer to there was some reference in there to the pharmacy board and the situation there on a ruling made by Judge Hardy some time ago, moving it from a Schedule 1. And I know that's under appeal right now, so that's still hanging. I just concerned that the way it's written under the criminal justice, it kind of police violence. I don't know exactly what that would mean regarding the use of marijuana or not. So some things in there that I still have a little bit of concern with. Yeah, another piece of that would be, for example, the getting a job. It mentions getting a position. We hire people within state troopers, for example, who admitted to using marijuana. I know that even the Metro's the same way, and the Clark County District Attorney's Office is that way. So it's a little misleading, in my opinion.
Understood. Thank you, sir. Thank you, Director, for your comments. Was there anything else, any other concerns with the report on your end? Director, was that Director Tagliati, anything else to add?
No, that would be my concern. I believe that may have been it. It's not presently. It doesn't give a clear picture of where we are today
if nothing changes, this kind of gives you an idea that it just gives you, if you didn't know anybody, we look at this and think that right now we're taking people who have possession of or even sales of the things that are a felony, and it's just not. And the jail's being full, or there's being a lot of violent interaction with police department. I don't know of any, and I think, and to that extent, it's a bit misleading. Same thing with the number of people in prison. I can't speak for every county in Nevada, but I can certainly tell you in the majors within Washoe and Clark, selling marijuana will not get you in, not put you in jail unless there's other issues with it. They may find a weapon, maybe you're a felon, or maybe it's a stolen weapon. And then really the other piece of this that concerns me a little bit is because of the world that I'm in right now, is the illegal market's not gone away. If anything, it's grown. And so I think we have to take a broader look when we say, okay, we're going to change the schedule, et cetera, et cetera. I don't have any problem with that. My problem is we got to make sure that law enforcement, you refer to here as criminal justice reform, stays in lockstep so that the industry is not just being hammered by all of the false sales that are out there. And some of the cartels, they were making just tons of money off of this stuff, which are basically are going to be hurting the market, which I don't want to ramble on here, but also I'm concerned with some of the growth that we have found up in northern Nevada, where who knows what they're using for pesticides, who knows what they're using to enhance the growth and so on and so forth. So that product has numerous health issues as well. So we got to make sure that there's integrity within our industry here in Nevada, and that's the key. When you buy something in Nevada, it's what you're going to get, and it's going to keep the community safe. I'm concerned that if we don't balance law enforcement and law enforcement's involvement with the industry, that it's going to cause some issues with the illegal market. You could even mention, take as an example on the Strip, instant deregulation, what would happen on the Strip as far as illegal sales? Would it spike? Would it be situations where we now have other issues that have to be dealt with? I think we need to take a closer look and work more, again, I said in lockstep with the industry, because just by saying, well, there won't be any more felonies, nobody will go to jail, et cetera, you'll be able to get a job. That's misleading. Because we're still going to have issues out there, and I think if we don't progress together and do the right things for the community, we're going to have more problems than we know what to do with.
Terrific. Thank you for the comments, Director, and definitely, want to continue the conversations on public safety and illicit market with you.
Again, I'm not opposed to the anything the direction the industry is going. Please understand that. My concern is I see more from the other side of all of the potential of the illegal, and we're talking about cartel-driven major growers, major transportation. And as we see it decriminalized for the industry, I also see where we could commercially come up with 70 pounds being illegally transported through the state, and it's not even prosecuted. We're losing any appetite for prosecuting cases like that. Well, eventually that's going to come back to hurt the industry. I know there was some talk last session about having my department, in particular, help in looking at the black market in Nevada as the industry grows, is the black market growing as well. I'd be more than happy to be involved in that. Our agency would love to be involved. Again, we can't, there's a funding issue as far as the number of investigators who can be dedicated to this, but we have to be careful of what forces are out there on the illegal side that are going to damage the industry.
Yep.
And that would be my main concern, that piece of it.
Yep, totally understand, and absolutely want to continue to work with you on the illicit market. I will kind of steer back though towards specific to the the report in front of us. So absolutely, we talked several times since I've come on board. So looking forward to continuing that conversation. So terrific. Dr. Spiritus, did you have additional comment on the report?
I do. Nick Spiritus for the record. I want to address Dr. Tung's comment in terms of public safety. It has really nothing to do with interstate commerce. It has to do with if a product is produced in another state under their laws. Example, in Arizona, a growth factor that is completely legal here is considered a pesticide, and considered a pesticide here and is illegal. In that situation, manufacture of a product in Arizona, if this is a federal change in the law, could be sold here and under completely different conditions than what the product here is being tested. And I think we really do need to consider consistency, because if this is an issue of public safety and medically, then I think that's truly important and shouldn't be ignored. And they should be held to the same standards. And if not, the product needs to be retested prior to sale in the state.
Excellent. Thank you for the comments.
Director?
Yes.
Yeah. So, Aaron Ford for the record, it seems to me the question becomes whether there needs to be an amendment to the report before it can be adopted. And if not an amendment, if there's an opportunity for a supplement to the report because in the current instance, it's due in about a week. And with our first time having looked at this is the first time you've been able to get feedback from those who have concerns about it. So, I guess I'm asking the director, what approach would you care to take here? Do we vote on the proposal as is, with a contemplation that these further topics will be addressed on different agendas? Do we table this and come back in a week or however many days we have available to us before the deadline is due to reconsider this? Do we allow the Scrivener to receive input from Director Tagliati and Dr. Tung and others to amend this, and then we authorize approval based on that amendment? How do you want to proceed here?
I would say we probably propose a vote as is, and if that got rejected, then I would say if there were that many problems with the report, because I think I'm hearing that there's not necessarily like wholesale changes that need to be made, but possibly contemplate the report as is with my direction, then to come back, not necessarily work with that subcommittee because that they've served their purpose, but bring back to this larger group for future discussion items specific to the report, because I would think the criminal justice piece, the lab testing piece would actually be outside of this report specifically as constructed, but certainly, for further discussion, because I would love to have these additional discussions. But specific to this report, I would think we'd maybe want to vote on this. And if it doesn't pass, then pursue other avenues. Chrissy, is that?
I'd agree.
Okay.
And if I may, let me just offer a friendly amendment to that. Is there a possibility where the items mentioned today could be put in a footnote saying that the committee also recognizes issues related to, and you detail them X, Y, and Z? I'm not saying a big treatise, but simply a footnote that says it. And further to that, we will, the committee will continue to address, or the larger committee will address this in future meetings, and let that be it. And I think that we can entertain a motion that allows you to do that, and then be able to present this report in the timeline that's accorded under the law.
Excellent. Mayor, I'm going to check with counsel, AG Ford. Chrissy, would that be?
It could be a motion to approve the report subject to that.
Subject to that amendment. Okay. Yes, AG Ford.
Okay. Okay. So when you're ready for that motion, I will make that.
Terrific. Thank you.
Director Hum, can I jump in really quick? This is Shelley
Yes,
Hughes,
please, Director Hughes.
Executive Director for Taxation. I just wanted to let everyone know that I was here I'm present for the vote.
Terrific. Thank you. Any additional discussion on the report?
Yeah, this is Member Britton for the record. I think a lot of what was brought up by and seconded by Dr. Spiritus was thought about in our discussions when coming up with the report. And I think what we determined the best course of action would be on topics, such as the one you brought up, those would likely be more of policy issues as we come, to any change. We believed that if there was interstate commerce, as an example, that would involve some sort of, multi-state compact between states that would have some sort of interstate commerce, which testing issues and things like that would start to come up. And I don't particularly think it was germane to the report, but that's just my take on that.
Excellent.
Yeah,
Thank you, Dr. Spiritus. Oh,
may I just offer one more comment?
Sure.
This is Andy Klein. I agree with what Member Britton just said in terms of interstate commerce and testing. I think there's an easy fix here, and I agree with Attorney General Ford on this. If we're talking about what Director Tagliati was saying, our view has been, and I think this is consistent with, I believe Attorney General Ford signed a letter with 12 other attorneys general. Our view has always been that moving cannabis to Schedule III will support the state regulated industry, which actually has packaging and labeling standards, age verification, testing, requirements that keep people safe. And that will necessarily push out the illicit market and put more pressure on the hemp-derived cannabinoid market, which does not have those same protections. So I think if there's an opportunity to do it, I think we could really easily say that in a footnote, if that's something the committee wants to consider.
Great. Thank you. Dr. Spiritus?
I'll pass. Thanks.
Okay. Any additional discussion? All right. Seeing none, I will actually close that item, right, Chrissy?
Yep.
Excellent. So I will close item 4 and move on to item 5. Consideration for the approval of report and recommendations of the subcommittee on rescheduling, descheduling to the Joint Interim Standing Committee on the Judiciary and the Director of the Legislative Council Bureau. So this is for possible action. I will open it up to a motion.
Sir, Aaron Ford for the record.
What was your motion, Attorney General?
I would move that we adopt the report as presented, but amended by a footnote that details the items mentioned at today's meeting by Director Tagliati, Dr. Tung, and others.
I'll accept a second.
Aye.
I'll accept a second to the motion.
Member Hughes, I'll second.
Terrific. I have a motion and a second. I will now open it up to vote. All those in favor say aye.
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 Those opposed say nay.
This is Director Tagliati again. Before I say nay, I just want to understand, my concern just right now is just in the document itself that I've just felt the criminal justice piece of it is not accurate. It's a little bit misleading. So that's my opposition to it. Again, part of this is being unable to hear my volume issue here. But if we could amend that in any way, shape, or form, and I don't think it's critical at this point, but it's just inaccurate. So if we can amend it, then I would be for moving forward. Otherwise, I'd be opposed.
Okay. So the motion does incorporate that amendment, Director.
Okay. Like I said, I have trouble hearing.
Yeah, so it will incorporate the amendment via footnote of your concerns for us to continue to look at that and research that.
Okay, thank you. Thank you much.
Okay. So is it still a nay, Director?
Not as you spoke, not as you just mentioned. As long as I can have that, yeah.
Excellent.
I think we could sell that piece. I just think there's a better way of presenting it.
Understood. Thank you for the
and
comment,
making it
Director.
more accurate, because right now it's inaccurate.
Okay. Thank you.
Just confirm if there's any other opposition.
Any additional opposition to the motion as presented? There is not. Motion passes. Thank you. Excellent, excellent discussion. So moving on, thank you, everyone. Now, item number 6, future meetings. So for discussion only. So actually, I'll segue slightly to this. So obviously, based on the amendment, it seems like we want to have additional discussion. So I will reconvene with team. As mentioned, have talked to Director Tagliati a couple times about this. Obviously have had the chance to work with other members of the commission on some of these issues in the past. So we'll continue to do that. I'll work with Sarah on team as well as the rest of the team to bring additional items forward to this committee at large, as well as looking at other potential options for some subcommittees. Speaking of the subcommittees, Member Terry, who is the chair of the Market Participation Subcommittee, unfortunately was unable to join us today. But just as a heads up to the group, his subcommittee has met once and will be meeting again in the coming weeks, continue working on a pilot program proposal. And we foresee the CAC meeting again once the subcommittee is ready to present their ideas. Again, as well as if there's anything larger to bring to the group, especially out of the fantastic discussion that came about today. So want to continue the discourse on that and speaking about all of those exceptionally important issues on the lab testing, potential interstate commerce, and of course, criminal justice. So, but I will open that up to discussion to any of the members on future meetings. Dr. Spiritus.
Yeah. Nick Spiritus for the record. Will there be regularly scheduled meetings or are they all ad hoc?
They've, Jimmy Hum for the record, they've typically been ad hoc, but certainly something to consider if we wanted to move those to quarterly or every 6 months, depending on what the subcommittee's findings are. Again, given everyone's busy schedules, don't want to do a monthly thing, but as business arises, want to make sure that it's brought to this larger committee. Because again, personally, obviously I'm new. This is exceptionally helpful to me. Informing policy and talking to all these incredible folks that we have on the commission.
My comment about regularly scheduled meetings such as quarterly or every 4 months is because we are all exceptionally busy, it's easier to schedule than
have it. Yeah.
With shorter notices.
Understandable.
That would be my only comment.
Okay, terrific. Thank you. Any additional discussion on the future meetings agenda item? Seeing none, I will close the agenda item number 6 and move on to agenda item number 7, public comment. Amber, do you need to reread the phone number?
No, I don't, and there is no one online to provide public comment.
Thank you. Anyone in the room here in Vegas? No one else has joined us, so no public comment down here. So I will just close, as I always do, with a thank you. I know all of your time is incredibly valuable, so thank you, and looking forward to submitting this report to the legislature. And item number 8, adjournment, everyone's favorite.
Move to adjourn.
Oh, sorry. Take a motion? Yeah. Oh, well, I accept it anyways. Thank you, doctor.
We do it the motion.
Yeah, there you go. Thanks, everybody.
Thank you.
Thank you.
Don't give a motion. You don't.